Hi, everybody. Welcome to another edition of Business Matters, the Broomfield Chamber of Commerce video podcast. I'm your host, Pat Monticelli. Thanks for being with us today. Before we get into today's topic, I wanted to ask everybody to like and subscribe to this podcast, like our channel as well, so we can keep bringing these your way. Today, we're doing a member spotlight with the Center for Spine and Orthopedics, and I am pleased to have Dr. Jacob Rumley with me. How are you today?
Great. Pleasure to be here. Thanks for having us.
We're excited to have you here. I know it was sort of a last-minute thing to get you in here today, so we're really happy to have you in here. And Center for Spine and Orthopedics is one of the newest Broomfield Chamber members, and we're thrilled to have you as a member of the Chamber. Describe a little bit about what you all do, what the center does.
Yeah, so the Center for Spine and Orthopedics is a multidisciplinary clinic. We have orthopedic surgeons, we have a podiatrist, and among our orthopedic surgeons, we have the subspecialties of spine orthopedics, sports, shoulder, and we perform general orthopedics. We also have pain management, physiatry. We try to be a multidisciplinary one-stop shop for musculoskeletal care.
Great. And I wanted to ask you, and you've mentioned a little bit about your specialties. How did you yourself get involved with the practice?
I grew up in northern Colorado. I'm from Bellevue, Colorado, which is right outside Fort Collins, and went to high school up at Poudre High School. Then I actually ended up going to college at Colorado State. Then, through life circumstances, I elected to join the U.S. military, then traveled around and did my training in orthopedics through the military. And I was married when I was in the military, still am, to a wonderful wife of now 15 years. And I kind of took her all across the country, and she wanted to come home. So in coming home, the Center for Spine and Orthopedics offers a lot of other things besides just orthopedic spine care and an ability to practice. We focus on education. So we have a research foundation there, and we have fellows that we train, not just American spine fellows, but also international fellows. And that was something that I had a passion for. I wanted to be able to reach a larger community and improve spine care.
Great. Let's talk a little bit about the situation with medical care in general and COVID, because it's probably been very different seeing patients over the last year or so. How does that work in your practice? Has that been manageable for you all?
It has been. It's been hard for everybody. And when I say hard for everybody, I'm not just saying for the physicians. It's mostly hard for the people who are, in their homes trying to be safe. We've really taken an effort to make sure that the patients are safe for a while, and actually still we focus on the CDC guidelines. Mm-hmm. We want people to feel like they can come in and be seen and not wait on significant spinal issues. I will say from the healthcare side, I've seen a lot of patients waiting to get something taken care of. I was late today because I had somebody who was afraid to be seen for their healthcare problems. They were losing their ability to walk. Mm. So, if anything, COVID's hard. I'm not a virologist,
sure.
So I can't really speak on, the policies and whatnot, but in the end, our goal is to keep everybody safe, and people should feel safe seeking out medical care.
And I think that's the important message, is that, as you said, problems will only get worse if you try to delay them because of a concern. And it's great to know that your place and several others are working to make sure that everybody is safe. When it comes to patients that decide they want to be seen, what is the process like for getting an appointment with the Center for Spine and Orthopedics? Are there prerequisites, other visits that have to be made? Walk us through that process a little bit.
So, the hardest thing for a patient to do shouldn't be seeing a doctor, right? So obviously some insurance companies will require a referral from their primary care, things like that, but they should feel empowered to be able to call our clinic. They should be able to go on our website, look at our surgeons. By a simple phone call to our clinic front desk, we'll help them figure out what it takes to get in. They can also go to their primary care physician and specifically ask to be seen by the Center for Spine and Orthopedics. And we take all insurances, so that should be something that they shouldn't have to worry about. That should be something on us to figure out for them.
Absolutely, great. What other details can you tell us about, just generally about your practice? What are the hours of operation? Those sorts of things. Where you're located?
Yeah, so we're located off Grant Street. Our specific address is, I want to make sure I get it right, 9005 Grant Street.
Yeah.
which is close to North Suburban Medical Center. We're not directly tied to them. It's just that's the closest hospital people probably know.
Sure.
We are open from 8 to 5, Monday through Thursday. Then we close at 1 o'clock on Fridays. The clinic, as far as the research side of that, we're open late many days, and we have somebody on call and available 24 hours a day through our clinic.
And you had mentioned you were in a procedure earlier today. Yeah. Do you do procedures there at your location or at other places?
I perform surgery in multiple places. So okay. I do most of my surgeries out in this area at Good Samaritan, Avista, then St. Anthony's North. I also do procedures and surgeries at North Suburban and the Musculoskeletal Surgery Center. There are some in-office procedures that we do offer. That tends to be more the less invasive injection type procedures that are performed there.
So let me ask you one more question. Why was it important for the Center for Spine Orthopedics to affiliate themselves with the Broomfield Chamber of Commerce?
Absolutely. So I think anytime you're a part of a community, you need to be involved in the community. And I think through the Chamber of Commerce, it gives a lot of opportunities to also be able to work with other businesses to make sure that there is some oversight into the products and the people that are involved. And I think that by us joining the Broomfield Chamber of Commerce, it gives us a strong hand to hold within the community so that we're not separate.
Dr. Rumley, thank you for being here today. We appreciate it, and we're so happy to have the Center for Spine Orthopedics as a chamber member. Remember that you can reach out to them at centerforspineandortho.com. That is the website for the Center for Spine and Orthopedics. That's it for this edition of Business Matters. Don't forget to like this podcast and subscribe to our channel, and we will see you next time.